So, dude, hey, welcome to the podcast.
Thanks for having me.
Dr. Andrew Doe. I think this will be a cool episode because I flew down to Houston to do your treatment, and I posted a little thing about it in your office.
Yeah, thank you for that.
And, dude, my Instagram is blowing up.
Nice.
People want to know about this, you
Yeah.
know? And I think one of the coolest reasons why you have a lot of validity in like our community to treat people is because you're a black belt in jiu-jitsu too.
Yeah. And the treatments I swear by because I'm still using them to get through and to maintain that level.
I think a lot of doctors, well, really anyone that doesn't train can't understand what our bodies are going through. And like yesterday, you said something to me that like as a jiu-jitsu guy makes perfect sense. But if you don't train and understand that, you're like, I like bottom side half guard. I play right hip down.
Yep.
And because of that, I have certain ailments because my body is out of alignment. And I'm like, dude, that's so awesome to hear a doctor be able to articulate that and then understand how that affects your body. Because without putting in, I mean, how long have you been doing jiu-jitsu now?
I'm on my 24th year in August.
Okay.
Yeah.
How long have you been in black belt?
So I've been black belt. It'll be 5 years in November.
Okay.
Yeah.
Dude, it's so fucking awesome to have expertise on both fields.
Yeah, and I always look at jiu-jitsu as the progression is you show up and you're just trying to figure out what the heck's going on. And then you're there long enough and now you figure out, hey, maybe some new guy comes in, I can see if this stuff works. And then you find out, yeah, it works. And then you get the blue belt and purple belt and you start to figure out what your body style and your way of thinking works. And then the rest of the time you're kind of perfecting your game. But when we do that, everybody's got a different game. Everybody's got a different body style. Everyone's got a different way of thinking of jiu-jitsu. And when we do that, even though we're really good at jiu-jitsu, we get all these muscle imbalances. Because what we like to do is usually never symmetric. We're always using one side of our body more than the others. And as we get older, these muscle imbalances are really what catch up with us. And those are the things that lead us to injury. So, most of the things I do trying to kind of restore that muscle balance. And a lot of times, you have these injuries, and even though you're active and you're working out and you're still doing jiu-jitsu, you're still kind of furthering that muscle imbalance. So it's a lot harder for these injuries to get better. So I really believe that, especially at once you hit that 35 plus age group, you got to get a little help. You got to do the rehab exercises. You got to kind of get rid of that muscle imbalance. But without kind of controlling that inflammation, repairing that tissue, you're going to kind of get stuck in this rut. Mm-hmm. And the great thing is we're still at the beginning, figuring out how these work, but we have some new, really good options to kind of help heal these connective tissues, which we never had before.
Yeah.
Up until probably 10 years ago, it was steroids control the inflammation, exercises get rid of muscle imbalance, and hope you got over it. But connective tissue just doesn't heal. And now we have studies, we have good products that do things we could never do before. Like I told you about the knee study with the VA, give a guy, we call it regenerative medicine because unless you're in an academic study, we can't call it stem cells, but it's along the same lines. And did an MRI on this guy every month for a year, and lo and behold, that cartilage regrew, his meniscus regrew, and it was normal cartilage tissue. So we don't know anything that does that.
Yeah, and unpack what you kind of told me yesterday about how there's 3 different types of cartilage that can grow in your body.
Yeah, so this will be easy for the jiu-jitsu guys because, the ears. So the ears are elastic cartilage, nice, smooth, soft cartilage. The joints, they all have this nice cartilage that lines them, very similar to what's in the ears, a little bit harder. It's called articular cartilage. So you have elastic and articular cartilage, and those are your nice, healthy, normal appearing cartilages. When we we get cauliflower ears or we hurt the cartilage in our knee, the only way the cartilage can repair is to put down this fibrous cartilage. So that's why it looks really, kind of all mangled and just looks like somebody slapped pieces of cartilage on there to try to help it heal. And when we do this regenerative stuff, we're seeing that not only do you get the healing of the cartilage, but it heals, either an elastic cartilage or articular cartilage, not this fibrous cartilage. So, that's the biggest clue that this is outside of the body's normal ability. And this is more towards that kind of newborn healing growth ability.
Mm-hmm. Is there a reason why, like, I don't know if it's modern medicine is the right term, but it feels like a lot of people in the medical field are reluctant to give this stuff validity yet? Because like I told you, when I went to an orthopedic surgeon, he said, you're approaching bone on bone, your femoral condyle on your left knee, your cartilage is almost gone. And he said, there is nothing you can do. And he was like, he was so adamant about it that, like, I mean, I'm not a fucking doctor, so I can't have any type of like legitimate discussion with him about this. It just didn't feel right. Because I said, you're telling me like there's no diet, there's no exercise program, there's no stem cells, there's no PRP, there's nothing that can help me. And like I told you yesterday, he goes, the literature does not support any of that. And it's like, why is this kind of like taboo to some physicians?
I don't think it's as much taboo, but I think a lot of physicians are kind of very leery of moving outside the norm or trying something new. And, the scapegoat is always, oh, the evidence isn't there. Mm-hmm. Well, the evidence only gets there by doing it. We're in Houston. You have DeBakey here. I mean, the guy went and get his own pieces of fabric and made these tubes, basically hoses out of fabric, stuck them in the autoclave to sterilize them, and then started sewing them in people and came up with the bypass. Hey, yeah, there's no evidence to support that, but guess what? Blood wasn't getting from point A to point B, couldn't get to point B the way the patient was, but now they could. Mm-hmm. So, yeah, no, there's no evidence. There's nothing that says this is the right way to do it, but it works. So then, you've kind of got to think outside the box. And I think in this whole regenerative community, there's kind of three sides. There's this side that says, oh, it's bogus, it's placebo or whatever you want to say, and there's no evidence to support it. Then there's the side that says, this does everything. This is the fountain of youth. It can cure anything. And there's a lot of doctors, certain doctors really jumped on this and said, oh, you got to get IV stem cells, and then you got to get, injections in your joint, and you should do it every 6 months. And I'll tell you, there's no evidence to support that. And like I told you, we do it once. Some people get better. Some people stay better for 3 years and say, hey, I want to do it again. I think I'm going backwards. Some people I never see again. So that third group is kind of in the middle that says, hey, this works, but what we got to figure out is the best way to deliver it, the best things it works for, and, what to do after care. Mm-hmm. So I think that's really where we should concentrate, and that's really where I try to practice. There's good studies that are out there that say if I give you stem cells IV or regenerative medicine IV, it gets stuck in your lungs. And, it's not going to go to your brain and fix your TBI. It's not going to do this stuff. That's why the studies that are going on now, they're directly injecting it into basically into your brain. They're going into the spine and putting it into that cerebral spinal fluid so it'll spread out and kind of cover that whole area. But we know that if I give you stem cells IV, even if some of them make it past the lungs, none of them go past the blood-brain barrier and get in the brain, so they're not going to heal anything up there. They don't get into the joints. They just can't do that. So I think right now what we know is we've got to do this direct injection into the joints, and that's really where we've seen good results. And we do have some good evidence. Rotator cuffs, we have really good evidence. Hips, we have good evidence. Plantar fasciitis in the foot, we have good evidence that shows that this stuff is probably the best treatment. And then, some people are afraid to extrapolate, but the tendons in your rotator cuff aren't any different than the tendons in your knee. So there's no reason it can't do the same. Cartilage on the bone in your humerus is no different than the cartilage in the bone in your femur. So you can put it in your knee, put it in your shoulder, should do the same thing.
And when you inject it locally, and I actually want to get into my specific procedure maybe in a little bit, but your body kind of retains it in that specific location, or does it kind of dissipate throughout? Or
so the idea is, and we do know this, that when you inject into a joint space, there's not a lot of stuff that travels in and out of that joint space. It's kind of a closed space.
That's why they're so slow to heal too, correct?
Yes. So it's hard to get medicines in there. That's why if you get an infection in the bone, it's really hard to get rid of that infection because there's just not a ton of blood flow getting into that area. And especially with connective tissue, there's really no blood flow to do it. That's why years ago, Dr. Andrews, the big NFL and pro sports doctor down in, I think he's in Alabama, he was starting to do this thing where he would go into the knee for these patients with these chronic knee injuries and meniscus injuries, and he would basically chisel the bone so it would bleed into the joint, thinking that would release the factors and get it to heal. Kind of like PRP. A lot of people are on this PRP, trying this PRP stuff, and there really wasn't great evidence to support it. And another guy kind of along my lines, a Division I wide receiver for the University of Georgia years ago, and then went in the Army, became an orthopedic surgeon, does sports medicine. And I called him and asked him about this years ago when I was first looking at it. And he said, your blood's 40 years old. It's going to be 40 years old in your knee. It's going to be 40 years old in your arteries. So why would that help you heal? And I said, it makes a lot of sense.
So that goes for both PRP therapy, and then there's even a way to extrapolate stem cells through that, right?
Yeah. So a lot of these places that advertise stem cells, they'll say, you come in, they'll pick a donor site. Usually it's somewhere, and they'll pull a little marrow from your pelvis or some other big bone that has bone marrow in it. They'll spin them down and grow your own stem cells. And the reason they have to do that outside the U.S. because the FDA says once you do that, it becomes a drug.
Okay.
So it's not your cells anymore. Now it's a drug. But there were great studies done that show that even though these look like the newborn stem cells, you can't tell the difference between these and newborn stem cells. But as soon as you inject them into someone's body, they do what's called senesce, and they become your normal age cells. They don't act like stem cells anymore.
In the stem cells that I use, or not the stem cells, I used exosomes.
Yes. But
you said they are prevalent in basically children 1 and under?
Yeah. So, we call them newborn. It's kind of arbitrary when the newborn phase ends, but these stem cells all come from normal DNA, normal full-term U.S. babies born normally, to be redundant. But
yeah, like you even said, if a woman has a C-section,
yeah,
that's a disqualifier.
They're disqualified. Some companies will still use those as long as everything else is normal, but I only use the companies that are 100% all those things.
Well, and before we go on from here, I think it's an important thing to share is that, especially with the way the world is now with the vaccines, a lot of people are very concerned when you talk about fetal cells or baby stem cells, they start thinking, abortion.
Yes.
And so I think it's important to articulate no. The procedures that you partake in are only out of healthy, natural born babies, and then it is extracted from the placenta after the fact.
Yes, exactly. It comes from the placenta and the cord blood. Mm-hmm. So, it's got all these growth factors because that's what the baby's doing in there is growing, and it's going to continue to grow, and that's where the growth factors come from. So, and then the labs that I use, I've seen all the labs are, they meet all the standards as far as sterility and all those things, and they're all U.S. based because I tell everybody this, there's one thing I'm not going to leave America for, and that's for healthcare. Mm-hmm. As much as people want to claim that we're not the best healthcare system and all this stuff, well, bureaucratically, no, we're not. but outcomes, we definitely are. And we're far and away better than anybody else.
Yeah, well, like one thing you said yesterday is that, so after it's extracted, it is all like rigorously tested for what abnormalities.
Yes.
So you know that what you're putting in your body is coming from a healthy placenta. Because what was the one from Russia? You said that the Russians were extracting.
Yeah, so people were starting to use, newborn stuff, and then people were starting to say, hey, well, maybe these in utero babies have even better stuff. And
it's starting to get weird.
Yeah. So in Russia, they decided to go into, from the mother themselves. I don't know exactly which part of they got it from, if it was from the placenta or whatever, but they went in, they took some blood and some cells out of this fetus while it was still in the mother, and unknowingly didn't test it, and just injected it in another patient to try to help heal. I forget what the injury was, but come to find out the baby had some tumor disorder, and the patient they put that in ended up getting the same disorder. And the tumors, actually the stems, the genetics of those tumors match the genetics of the baby, not of the patient that got them. So that was one of the things.
They could make the 100% connection that this procedure is why you're growing tumors in your body.
Yes. So then everyone kind of would you reference that and say, oh, look at what can happen and all this stuff. But, the good thing about America is, rigorous testing. And even if you try to slide through, like there was one stem cell company that tried to do it, claiming they had American products, and they were actually getting them from wherever they could. And then they had a huge issue with infections. And a lot of these patients got a massive infection in their body called sepsis. And so basically they had to submit, I think it was 12 samples, and 10 of them came back with bacteria in them. So they weren't processing them appropriately.
Didn't you say some of them were coming from like South America?
Yeah, South America. And
so let me ask you this then, for listeners that hear this, I have a lot of athletes and jiu-jitsu guys that listen to the show that are interested in these kind of treatments. If they want to pursue looking into different clinics, how are you sure that the place or the doctor that you choose is going to adhere to the rigorous standards and testing to make sure you're going to a legit place?
Yeah, so that is a difficult thing. I will always give my patients, the name of the lab that I get my stuff from, and they can research them as much as they want. But I don't know legally what that lab has to tell these people. And you never know if someone's being 100% upfront about things. But it does take a little research on your side, I should say. And you just don't know yet. And I've changed things in the past, but I always make sure that I talk to the people, the directors of the labs and the head scientists and things like that. And I have the questions that I ask, but you just don't know how rigorous your physician's going to be. So you kind of got to do a little work on your own. And then one of the things I will say is price. There are people out there that are the same people that are telling you this cures everything. They're out there selling you the dream, and they're just charging this insane amounts of money. I mean, when this started, people were going to Mexico, get their own stem cells put in. Some were paying over $100,000 to do this, And I still know people to this day that are paying, I think, in the $30,000 to $50,000 range. Plus, you got to travel somewhere, you got to get a hotel, you got to do all the other stuff on top of that. So, when you see this insane price, I think it's up to you as the consumer, not as the patient, to try to say, hey, I want all this evidence. And until you provide me with this, and if they won't provide you with that, then that's probably a flag that you should, go somewhere else. And this is part of my practice, but to be honest, this is something more, I do this more because I want to know, because I want to use it on me. I want to remain healthy. And like you said earlier, wealth is health. Health is one of the biggest signs of wealth.
For sure. Yeah.
And, if you can't move and you can't do things, you can't enjoy all the money you have, you can't enjoy all the time you have, I mean, what good is it? So I do I got into this, I started this, and I did a lot of this for myself and for our brother Seth.
And Seth, like after Seth had his knees done, he called me and he's like, bro, I feel 12 years old again.
Yeah.
And like, I mean, we were talking about it yesterday. That motherfucker used to hobble around and he had his foam roller with him everywhere and his lower back had to get worked on. And then the crazy thing is when he had to have his neck worked on, that's ultimately what killed him. But he was always like, I mean, he lived hard, you know?
Yeah.
And so he fucking tried this and he swore by it. And for me, I mean, being a very close friend, and I know what a good athlete he was and how in tune with his body he was, that's all I needed to hear. That gave me the green light that, okay, there's something to this.
And one of the things he said to me after we did his knees, and actually we had switched the product to what we used for you, and the reason we had switched was because the guy the head scientist for this lab was a Navy guy that Seth had known, being a SEAL and kind of interacted with him, and he said, hey, let's try these guys because obviously you're a veteran, I'm a veteran-owned company, and I try to. If there's that connection there, it increases my trust, definitely. But I also want to give back. And the thing that he said to me about the whole knee thing was when he called me about 5 or 6 weeks after the injection, he said, I just went out and I squatted and, I could go, my ass to the floor and it felt great. And he said, but the biggest thing was, I didn't even register. I just walked out and said, I'm a squat today. And I squatted and I was fine. And I got done and I said, I wasn't even worried about my knee. I didn't even think about my knee injury. I just did it and I did it without any pain and I felt fine. He said, and to me, that was what registered. That was kind of, the injury's better. Maybe it's just because you didn't squat for 6 weeks, but the idea that the mental, the kind of that feedback that, hey, be careful, your knee's not 100%, is that also another thing that this regenerative medicine does is it says, hey, sends that signal, yep, knee's good to go. Yeah, we're back to 100%. So that was kind of something interesting I found.
Yeah, no, that is. So yesterday you articulated to me like that when people hear the term stem cell, it really is encompassing 3 different things. And then as of more recently, they've kind of moved away from the cell itself and focus on the exosomes and the growth factor.
Yes. So
yeah, let's get into that a little bit.
So I think the initial thought process was to take the cells from the newborn that can do anything they want, put them in your body, and wherever you put them, they'll do what they're supposed to. You take knee cells from a baby, put them in your knee, and they'll make the knee properly. And now as more and more information comes out, we're finding out that the big thing is our body can do it. Our body can repair, but we don't have basically, we have all the carpenters lined up ready to fix our joints, but they lost the directions, which are the exosomes, and they lost the raw materials, which are the growth factors. So now they're just sitting there saying, oh man, that knee's bad, that your meniscus is gone. Let's just slap down some of this fibrous cartilage and hope you go on, or they can't even get enough people in there to fix it. And it just kind of stays there and slowly gets worse and you get a tonal knee. Now we're realizing that if we give the body the directions and the raw material, then it can go in there and kind of repair the joint. And whether or not we have the cells seems to be less of a factor than we initially thought. It looks like we can kind of do it with our own cells. It's not as important to have those newborn cells as well.
Mm-hmm. And the stem cell itself, you said, was the most concerning factor for the body, like having an inflammatory response?
Yeah, so a lot of the, several of the products that we used before, the ones that I'm using now, we would do the injections and you'd have this period of healing. And, it felt like you were post-operative, like somebody just went in and fixed my rotator cuff or fixed my meniscus in my knee. You had, a couple weeks where you were in some serious pain and, limited to what you could do. And we're finding out now that that's probably more, not or less because of the joint healing, and more because when we get these quote unquote stem cells from these places, there's broken cells in there and they're exposing different pieces of the cell. And that's what causes our body to recognize it as foreign. Because the inside of the cell, pieces that are in there are foreign to our body. And once our body sees something foreign, just like the coronavirus doesn't belong in our cell, we start to attack it. And that's what's causing this big inflammatory response. So as we get away from those cells, and then when you go to the research places, they can be very thorough and they can make sure the only cells that are going to your body are live stem cells. And most of the cells we get commercially, even though people call them stem cells, the number of cells that are actually alive in there are very, very few, regardless of what, the manufacturer is telling you. Oh, there's 1 million cells in here. Well, yeah, but if they're all dead, it doesn't matter.
Yeah. Last night, because you said without introducing actual cells into your body, the inflammation and the recovery is dramatically faster. And I walked out of here and felt completely fine. Yeah. But then by about 7 p.m., I did have some type of inflammatory response, and it started to hurt pretty bad. And then when I woke up this morning, I could still feel it, but it's already dissipating because we were going to train jiu-jitsu today. Yeah. And I woke up and I was like, oh, fuck, I want to, but this doesn't make sense. Like walking, my knee feels very, it felt very similar to when the cartilage started to degrade and that pain that I felt, it was very similar to that. It was like almost identical. And I was like, man, this feels like when my knee initially went bad. And then 12 hours later, it's already feeling better. Yeah.
And with this Exosome product that I'm using now, I tell people, and actually you spoke to my tech yesterday, we had done his knee, but his knee was bothering him at the time. And, what happens is, and I had just done my right elbow probably about 2 months ago. And, it almost seems like you do this injection and you start to go into reverse. You go back to the point where you first injured it and it really hurts. And then kind of the pain will start to move around. And I think that's, the initial injury was here and then you hurt this part and then you hurt this part. And then you go backwards. And I noticed with my elbow, and I know my tech noticed with his knee, it went back to kind of one little spot and about a week or two. And that really hurt. And then all of a sudden it went away and everything was gone. And
dude, that's fascinating.
It's crazy.
Now that you say that, I remember us having that conversation last night, but I didn't make that correlation last night when my knee was hurting in the exact spot that when it's bad, because there's like an ebb and flow to my pain, but it was right where it's always bothering me.
Yeah, and then you'll probably get to the point where you'll be like, my knee feels great, but if I touch one little spot or if I move one way, I feel this weird pain, this weird location. And, totally unsupported by any evidence. Just my anecdotal evidence, it's almost like that was the first injury you had. And that's what caused all this other stuff to happen.
Because my left knee is my bad knee, but you said yesterday, you're like, well, dude, you're down here. Should we do both?
Yeah.
I was like, yeah, fuck it. Let's do both. And I have zero pain in my right knee from the procedure. So that's interesting. It's like, it's somehow activating those pain receptors in the injury site.
And Seth noticed this more than I did because Seth would come down and we'd do like 20 different spots. Well, actually, it was about 3 or 4. But, he would come down and, we might do his left shoulder and his knees and the hip and stuff like that. And he'd say, you know what, man, even my right shoulder feels better. And we do think there's some systemic stuff that happens. Like you've got to be getting more blood flow and more cells and more chemicals or whatever recruited to do this repair.
Yeah.
I
think again, who am I? I'm no fucking doctor, but to think like the ingredients are inside of your body to promote healing, it doesn't seem out of the realm of possibility that it could influence healing in other parts of the body.
Yeah, definitely. And it's like, your body is saying, hey, go fix the right shoulder and make it perfect? Or is it saying, go fix the shoulder, and maybe some of that gets misdirected over to the left shoulder, especially if you have injuries in both shoulders. And one of the things I will say that, I'm always upfront and honest with patients about the limitations of this stuff. And I found out through myself and through a couple other patients that we did shoulders on that if you got a great big bone spur because of, chronic injuries, this stuff doesn't tend to do much for that because you have this mechanical issue and it's not going to overcome that. It's not going to remove kind of these, in the inflammatory response, we deposit calcium. So it's not going to remove like these big calcified things that we put down, whether it be a bone spur or, other calcification of ligaments and connective tissue and things like that.
Well, I think that speaks to the validity more, because when you got people that are telling you things that sound too good to be true, they're usually exactly that,
Yeah. Yeah. And, people want to be young, people want to be healthy, people want to feel better, for the most part. But because of that, that's really easy to take advantage of that. I always think of Mark Twain, it's easier to fool someone than it is to convince them they've been fooled. So I always try to tell them that, because for me, I don't want to be seen as someone who's out there saying, hey, I'm going to fix everything. And then someone doesn't get better and say, okay, no, this guy doesn't know what he's talking about. I'm going to be upfront and honest with you. One, we don't exactly know right now the best way to deliver this, how much to deliver, how many times to deliver. We don't know any of that. But I do know certain situations where I don't think it's going to help you, and I actually had a patient the other day and he wanted to look into it, to doing both of his shoulders. And I said, I think you're going to waste your money. Your shoulders are too bad. There's just too much extra bone in there. There's no connective tissue left. Not even that it's thin or it's injured. It's just gone. So I think, you're beyond the point of this. And
but with that advice, is it simply to say, like, I think you're wasting your money?
Yeah.
But with that in mind, if you understand I'm being upfront with you about it, is there any harm in trying?
No. And if patients push me and they say, listen, I still want to try, I'm like, okay, and I'll document it and say, hey, I don't think you get a good result, but if you want to do that. I actually had a lady, really nice lady in here. She was a massage therapist, and she had probably had some element of carpal tunnel in both of her hands. So, she couldn't do her job. And she said, if I go get surgery, I'm definitely not doing my job for at least 6 weeks. And I own my own business, so that's going to kill me. She said, I'd rather try the stem cells. So we did. We did a carpal tunnel injection in both of her wrists, and she did great. So the next time she came in, she said, okay, I want to do both knees and both hips. And I said, listen, I would love to have your money. It's great that you want to give me all this money, but let's go slowly and see what happens. And, because
I think that's human nature. Like, if one is good, two is better,
Exactly. Yeah. And what I'll do is I'll say, listen, we're going to get x-rays in all the areas you want to get injected first, and make sure there's not any of this kind of structural stuff that I know this isn't going to help.
So let's talk about the actual procedure itself, because this is funny, man. Like, I am not like averse to needles. That kind of stuff doesn't bother me at all. I shoot my TRT into myself weekly. You know what I mean? Like, it doesn't, I've never, when I have to give blood, or in the Rangers, we gave each other IVs all the time. We'd be up drinking and then like, oh, hey, let's hydrate before we go to bed so we can do PT in the morning. And
you didn't have general order number 1?
But like, I didn't know, I had no idea what to expect. So I was on the table and in and out before I even kind of put it all together. What was the whole procedure? 10 minutes maybe?
Yeah, for both knees, probably 10 minutes.
But when I laid down on the table, you have this machine that's like a live feed X-ray.
Yeah, and that's what it is real-time X-ray guidance. Yeah,
which I didn't even know that's a thing. And I usually watch, like, if I have this, you see that scar across my knuckle?
Yeah.
Like, I was fascinated watching the doctor stitch that up.
Yeah.
Even as a kid. Like, it's neat to kind of watch these procedures. But dude, there was a part of me that's like, I don't know what he's going to do. So I don't think I want to watch.
Yeah.
And it made me kind of feel like a pussy. but you probably didn't even pick up on this. You picked up a scalpel.
Yeah. Yeah.
And I saw that in your hand and I'm like, oh, does he have to cut to get in there? Is this like a minor surgery to get in there?
Yeah.
Is that involved at all? And then I was like, what's he doing with a scalpel?
Yeah, no, actually I was just using the metal and the blade to see where I am. And
okay. So I still didn't know. I was like, why is there a scalpel in his hand right now?
Yeah.
But I'm not going to say anything because it's like, dude, you know what you're doing. I'm just
No, and I have patients that say that. They're like, what? I actually had a patient, I was doing his neck, and this stuff we cleaned him with, had some iodine in it, and it started to drip down his neck, and he started screaming, I'm bleeding. I'm like, no. That's just the cleaning stuff. But yeah, so the procedure itself, I see a lot of doctors that will do knee injections and joint injections in general, steroids or whatever they may be, and probably maybe 75% of the time, yeah, you're in the right spot. But I was amazed that when I started to learn how to do this years ago in my radiology residency, you think you're in, but you're not in. You're not actually in the joint space. You're in some tissue plane where it's easy to inject and it feels like a joint space. So now
that's interesting, because I noticed you probably repositioned. You'd take a good look at the screen and then go back to the knee, and then go up and like take a good look at the screen.
Yep.
And then go back to the knee. And you probably did that, 5, 6, 7 times?
Yeah, your left knee was a little trickier because it was a little more advanced as the joint space gets thinner. Plus, if you notice on the right knee, we went from the outside, the left knee went from the inside. And that was just because of the way we were laying on the table.
But the interesting thing about that is the inside of my left knee is where, like, that's the source of my injury.
Yeah.
Does that matter at all, though? I guess it wouldn't, huh?
Well, typically when we see like the progression of joint of arthritis in the joints, because of the way humans walk, we do bear more weight on the inside, the medial part of our knee. Mm-hmm. So that's pretty classic for, if you see a patient with, that needs a total knee replacement, almost all of them, the inside or the medial side of the knee will have less joint space than the outside. And that's just from the physics of the way humans walk. Mm-hmm. But the procedure itself, it's a very small needle. And the nice thing is we can use the same needle that I'm putting the numbing medicine in to put the treatment in, whether it be just growth factors or exosomes. Some of the stem cell preparations, you need a little bit bigger needle because there's more stuff in there. But it's still not much bigger than the one that we used.
What was like 18 gauge?
We used 25.
20. Oh, that's little.
Yeah, tiny.
And so that was in the center of my knee?
So we use 1.5 inch, 25 gauge needle. And what we do is we get in, usually we're about, we're almost to the middle portion to where the ACL and the PCL are. And then what we do is once we get in there and it feels like we're in there, when I get in there, it feels like I'm in there, then I put in a little bit of the x-ray dye and I look for how it spreads out to know exactly if I'm in the joint or if I'm, in one of these tissue planes that feels like I'm in the joint. And that's when I realized, oh man, I thought I was in the joint and I'm not even close to the joint. So, well, I'm close, but I'm not as close I'm not in it like I thought I was. So that's why we reposition, because if you're going to spend this money, I'm going to use every tool I have to make sure it's absolutely in the right spot. Mm-hmm. And, I've done lots of blind injections thinking I was in the right spot. And, I said, wait a minute, this isn't a steroid injection covered by your insurance, where, there's actually good papers that show that as long as you're close to where you need to be with the steroids, it'll give you that anti-inflammatory response. But this stuff is, I want it to be in that space where the problem is. And I'm going to make 100% sure before I put this stuff in that I'm exactly where I want to be, which is inside the knee joint.
So then once you get into the knee joint, exactly where you want it, mm-hmm. The needle stays in, you pull off the one medicine or the dye.
Yep.
And then just hook up the exosomes and pump it right through the same thing, huh?
So I'll get the needle in the space. once I feel like, and what I do is I'm injecting numbing medicine as I'm going in. And once I feel that loss of resistance, like I'm in the joint space, then I take that syringe off, put the dye syringe on, inject some, look at it with the x-ray. Yeah, okay, I'm in where I want to be. Take that off and I'll clean it out, actually. You know, who knows if the x-ray dye will affect the action of the cells, but I just kind of flush it out with the saline.
Okay.
And then I put in the product, whether it be the growth factors or growth factors and exosomes like you got, or the quote unquote stem cells. And, you know, I'm actually telling patients at this point, you know, I think you're going to get just as good a result with the exosome growth factor mixture. I don't think you need to spend the extra money to do the stem cell side of it.
If people are looking into this and inquiring, do you have almost like a base level or a range of like a price range that seems reasonable versus unreasonable that you would be willing to kind of like hang your hat on?
Yeah. Oh, definitely. Because, you know, given the big difference on my side of things, obviously, is what it costs me to get this stuff. But the other big difference is how long this stuff is good for. Growth factors can come in a powder, and they'll be good for like 5 years because they're powdered. And then when you're ready to use them, you mix them up and you inject them. And so
you just use like bacteriostatic water and it go. And,
yep.
Okay.
Yep. Actually, we use preservative-free saline.
Okay.
You know, and inject that in there and then put that in the joint space. When you use the exosomes are frozen. They'll last up to 12 months, which is pretty good. And then if you get the stem cell setup, or the setup with the cells in it, then that's only good for about 24 to 48 hours.
Oh, so that's why it's dramatically more expensive.
Yes, and it's got to be shipped frozen overnight, and not just frozen, but it's got to be on dry ice. So it's, I forget what the minus 60 degrees or whatever the appropriate temperature is.
Mm-hmm.
So that's the difference between the three. So that's also the difference between the cost. And all the procedures I do include, you know, using the fluoroscope, the x-ray guidance to know exactly where I am, and then all the prep kit and everything that. And actually, the only reason I had the scalpel for you was that was the kit that my tech opened. But typically what I do is I have this great big clamp that I don't use for anything, and I just kind of set it under the knee to
as a reference point.
Yeah,
okay.
Because it's metal, and I can see it on the x-ray to figure out where to start. But so, you know, powdered growth factors, I would expect, with everything included, you wouldn't spend any more than $1,000. And that's even pretty high. I think when we do it, I'd have to go back and look because I just tend to do almost all exosomes nowadays. It was like $750 for the whole thing. And then the exosomes, a little more expensive, a little less shelf life. So those range from, and they only come in either 1 or 2 cc preparations. Well, they come in bigger preparations, but no joint really needs anything more than 2 cc's as far as we know at this time. And those range from, I think the 1 cc is $1,200, the 2 cc is $1,500.
Okay.
And then when you get up to the cell part, now this is where you see the huge price range. And I know even in Houston, people are charging, I think, $8,000 for 1 cc and then $16,000 for 2 cc's. And, you know, I wasn't a business major, but the school of finance that I go by is if you're buying one of something at one time and then you decide to buy 2 of something at one time, you should get a little break on the second one, you know?
Yeah.
So my prices are actually super low, and that's because I'm not trying to gouge people. I want to make people better. That's really what drives me, what makes me feel good. And a lot of the other procedures I do, you know, those are the main parts of my practice. Like I said, I do most of this because I want to stay fit and healthy and young, and then
help your jiu-jitsu teammates.
And help my jiu-jitsu teammates and my military brothers. So my stem cell price, we do it 1 cc, 1.5 cc's, 2 cc's, and it's $3,000, $4,000, $5,000.
Okay.
You know, so it's
well, and that makes it work. I mean, if you're looking to get this treatment and wherever you're at, like if you're in Miami and it's $10,000, well, fuck, dude, it makes sense to book a flight and a hotel
Yeah.
and come out here, you know,
Yeah,
or,
I mean,
you know, wherever you decide makes sense for you. But
yeah.
I mean, I made a weekend trip out of it and saw some friends and did some podcasts, and it's like,
yeah. And, you know, it's Houston. It's the third biggest city in the country now. And if you haven't been to Houston, don't judge it by when you're flying in, because it's an ugly city. But man, there's everything going on in this city. There's as much as there is in New York.
oh, bro, dude, when I got here, because I've drove through Texas a couple times on like road trips, but I haven't spent any time in Texas. But you always hear that Texas is like conservative and two-way and all the stuff that Texas has a reputation for. And when I drove through Houston last night, I was like, I fucking feel like I'm back in Seattle.
Yeah.
There was people sleeping all over the streets. There was tents all over. And I was
I'm
like,
glad we made you feel at home.
I was like, what the fuck? I said, dude, fucking Texas is just like Seattle. How do you get this reputation? And I posted something on my Instagram, and I had Texans fucking like come to bat to defend their state, you know?
Oh, yeah.
And I had all of these messages. It's like, we don't fucking claim Houston and Austin. That's not fucking Texas.
That's bullshit. You know, the nice thing about Houston is you have the best of everything Texas, and then you also have the best of, you know, everything. It's the most diverse city in the world. You know, and mainly because of oil. You know, hell, I go to Gracie Baja when I go to my jiu-jitsu school, West Chase, Pedro Marino, Ulpiano, and I'll hear 6, 8, 10 different languages, you know, in one night, you know, because we have guys from Uzbek. I know where all the oil countries are now, because those are the people that train at my gym.
Dude, that's so cool to hear. I always tell people, well, I'm sure we'll go on down some jiu-jitsu rabbit holes, but one of the cool things about jiu-jitsu is the diversity on the mats.
Yeah.
But we're all equals.
Oh, absolutely. It's like the military.
Yeah,
you know?
Exactly.
It's like, and you know, the funny thing about the military, you know, might upset some people, you know, that you get in the military and you'll hear guys, you know, throwing out slurs at each other and laughing and all that stuff. But when it comes down to it, you know, you guys are going to go through shit.
100%.
And you don't care what that guy is. As long as he's not shooting at you, you don't care.
No, dude, I've said on this podcast a lot, like when I was in Los Angeles on the U.S. Marshals Special Response Team, we had like 3 Asians, 3 Hispanics, 3 blacks, 3 whites. And we used to joke that we are like the most racially diverse team. Because it was, if you had to pick a racially diverse team for some fucking television advertisement, like we were it, you know?
Yeah.
But behind closed doors, there's the most racist fucking like verbal fucking warfare that you could imagine. But it was all in good fun.
Yeah.
You know what I'm saying? And it's like, dude, once you've been through some shit with guys and you have trust with each other and you know you're on the same team, dude, well, let's sling shit at each other because it's fun. You know?
Exactly.
But then the other side of it is like there is some stereotypes. And like, oh, I can't say this, right? You can't say this. But this isn't me saying it. This is the black guys on my team. We had a couple black guys. And our team would go in the mountains and do hikes and stuff sometimes on the weekends. And the black dudes on my team are like, I don't know what the fuck you guys... I don't know why you want to go fucking walk in the snow, dude. Like, our people don't fucking do that shit. We're sitting this one out, you know? But it's all in good fun and it's good nature. But there's also... I mean, stereotypes come into existence for a reason, right?
Oh, absolutely.
Because we're different, dude.
Yeah.
But it's cool to be different.
Exactly. You know, like my wife, her family is first generation from China here. And, you know, we go back and forth and we have 2 kids together and we'll joke, you know, kid does something stupid and she'll go, oh, that's their white side. They do something stupid. I'll say, oh, that's their Chinese side. You know, and it's because, you know, God, she's my wife. I love her. We obviously don't hold racial biases against each other. And one of the big things that, one of the funny, you know, amazing things I saw about Seth, because I met Seth before he went to Buds, you know, probably about a year before
I had no idea you knew Seth that long ago.
Oh, yeah. I knew, you know, Jordan.
Mm-hmm.
Jordan's who introduced me to Seth because Jordan got Seth to come in and train with us. So I knew him before he went to Buds. And then when he came out, and then we kind of reconnected when his wife was back in Houston training. And, you know, he'd call me and leave, you know, a Seth message. And
hey, motherfucker.
And then at the end, he'd say, I love you, brother.
I love you, yeah.
You know, and it kind of started to register with me. And then we started talking, and he's like, I talking to Seth's friend Chris, who I got to be pretty good friends with, and shit, man, that was a bad year. 4 months after Seth, we lose Chris. And Chris had said to me, he goes, Seth tell you he loves you all the time? I said, yeah. And I said, I didn't understand it at first. And then I realized, when you've been through that horrible shit, you don't need to prove anything anymore. And my oldest daughter, Seth, was like her hero. Every time he'd come, my daughter was sitting next to him, asking him question after question. She thought he was like the greatest guy ever.
Bro, same with my boys. I mean, they're not mine, but they're like, I filled a fatherly role to them. They're family, friends, and we're very close. And I used to take them out to the ranch, and we'd stay in Idaho and hunt his property. And to young boys at the time, they're like 10 and 11. Dude, Seth is like this mythological, like comic book character, dude,
and he acted like one too.
yeah. And so they're like completely intrigued with him, and it's just cool, man. It's,
And my oldest daughter, she was so amazed, happy, proud. I don't know what it was, everything. When Chris actually told us that Seth's big chest tattoo was to cover up his ex-girlfriend, Catherine's name. And that's my daughter's name. So she was like, oh my God, that's a sign. And my daughter actually has Catherine actually has Seth's trident. And when,
oh, wow.
Yeah. And when Atlas turns 18, he'll get it. And I thought that was really, that was really special. But the thing is, when I brought my daughter up for the funeral, for the celebration of life, I said, you're going to see the biggest group of alpha males, and they're all going to be crying their eyes out.
Mm-hmm.
And she was like, wow. She was like, really? And I said, you know what? The cool thing is, when you've been through that, when you know people on that level, you got nothing to hide. You got nothing to prove. You're not out like the guys on the street, mean mugging people, trying to be tough guys. You know who you are, you know what you can do, and you're totally at ease with it.
Yeah.
And you can really support, your friends and stuff. And now actually my male friends, I tell them I love them.
Yeah.
And at first they're like, what the hell? What's wrong with you?
No, this isn't gay shit.
Yeah, no.
I love you as a human being.
Exactly.
I think that's why I fell in love with jiu-jitsu so much, is because just like you said, when you've been through stuff with people and you've walked through adversity, you know who they are and you know who they aren't.
Yeah.
So once you have that intimate understanding of someone, there is no more posturing. There is no more ego. We don't have to pretend because we all know. And that's the same thing you get on the jiu-jitsu mats.
Absolutely.
Like, I tell my students all the time, is like, this gym has a pecking order. And like, when you slap and bump with your teammates, you already have a pretty good idea of what the outcome is going to be. Now, we all have those training partners that we're neck and neck with.
Yeah.
And you slap and bump and it's like a coin toss. And those are some of those training partners, in my opinion, are some of the best, because they force you to stay super sharp and be on your game. But regardless, everybody, if you look down the lineup at the end of practice, you know where you fit in. And that's not saying like, oh, I'm better than you, or I'm at top and you're at bottom. It's just, we all have an understanding of how we are positioned in this family. And now we don't have to be full of shit.
Yeah.
We don't have to pretend or posture. And what activity can you have 40 athletic men together and the vibe is loving and positive?
Yeah, absolutely.
And I think that's why, is because it actually puts us at ease to know, like, hey, I beat this guy beats me. And that's the reality of this planet. And I'm going to work to try and change my position in the rankings. That's what we're all doing, right? But we're comfortable with it because we know this is reality.
Yeah.
Rogan says it all the time. There's no lying on the mats. You can't be full of shit on the mats.
Yeah. Yeah.
And so that's why it's so powerful.
And actually Maynard from Tool always says, best thing about jiu-jitsu is it keeps you humble.
Uh-huh.
And when I first started jiu-jitsu, I was, trying to prove myself, trying to cement my status in the family, I guess. And it was always about who can I beat in the academy and who am I close to that I'm going to beat. And then I want to consistently beat them. Who am I going to be better than? It was always about being better. And then as I progressed, as I got, higher and higher, I realized, who cares?
Mm-hmm.
There's a whole bunch of things you have to realize. One, you train with these people all the time, so they know what you do.
Yeah.
That's why I think competition is such a great thing for people, because these people are naive to what you like to do. So then they have to kind of,
and you're naive to what they like to do.
exactly.
Yeah.
So you got to figure out who can adjust fire and figure it out faster and then get the win. And now I'm to the point, I had my, I guess I could call it a career, my MMA career and my jiu-jitsu competition career. And now I'm like this, I feel like I'm like this old man in jiu-jitsu. But what I do is I
How old are you now?
47 next month. So, it's like, this is my hobby now. This is what I do to keep myself fit. And I love it because it's cerebral and it's athletic and it's great cardio. And I'll just say, I'm going to do this today and just try to force it on everybody I can.
Oh, like I'm going to work mounted triangles or whatever.
Yeah, something crazy. And actually one of the greatest things I did shortly after I got my black belt, I said, okay, you know what? I got my black belt. I've cemented that I have that base level of knowledge in jiu-jitsu. I know what my game is. I know what I like to do. I'm going to try to do everything left-handed.
Oh, shit.
Oh, my God. Talk about tiring. You find it really fast on the mat who's left-handed.
Oh, yeah.
Because you're like, man, I can pass this guy's guard, no problem.
I had one training partner in California. His name's Marcelo Lapella Mafra. High-level black belt. He's a half-guard guy, but he plays left hip down.
Oh,
so it's a different thing.
It's so confusing because now,
it's like fighting a southpaw. It's a different thing, you know.
Exactly, and and the cool thing is I'm still not anywhere near as good with my right hand, but now I can change sides and do things like that. But the real great thing is it showed me, I can take anybody I train with because everybody does it. Once you get a higher belt, you start saying, okay, I think this move will work for me. So let me try it on white belts. Let me try it on blue belts. Let me, so you do that progression. And I found out, hey, once I lose my ego, I don't care if a blue belt or a white belt even catches me in some submission because I'm just trying to do this. I'm not out here trying to beat everybody. I'm just trying to do something new and see what I get out of it.
Yeah. And like, Gordon Ryan, who's arguably the best no-gi grappler in the world now, he says that all the time. He's like, I get submitted 20 times a night.
Yeah.
Because I'm always putting myself in positions where like I have to figure out a problem.
Yeah.
And if you are consistently doing that, even at black belt for a long time, I was like, I don't want to get submitted.
Yeah.
You know what I mean? And to tell you the truth, it's been recently that I've started to grow out of that.
Yeah.
And become comfortable. But the left hand thing is interesting because you waited till black belt to explore that, right?
Yeah.
And one thing that my coach, Joao Assis, says, he's like, listen, guys, when you're coming up through the ranks, find your strong sides and hone it.
Yeah.
He goes, because if you try and split your time being an ambidextrous fighter, it's going to be detrimental.
Yeah, you're going to handicap yourself.
Yeah, he goes, and this was always his phrase that he would use. He goes, because are you going to go home tonight and brush your teeth with your left hand?
Yeah.
It's not going to happen.
No.
So when you go to a fight, you're going to go to where you're best suited. But then again, like, there is no right or wrong answer. Because like now you're at a point where it's like, okay, I do want to develop my offside.
Yeah.
That's fascinating,
yeah.
dude.
And
like, it's so funny. Like, we can geek out on this stuff and people, and obviously I do a lot of podcast episodes. So the audience actually I get a lot of positive feedback when we talk about jiu-jitsu.
Yeah.
But people that don't understand it would be like, dude, these are two grown men talking about having their right hip down versus their left hip down. Like,
one of the, I have these little like phrases, cliches, whatever, these little things that people say throughout my life, and certain ones just really stick. And I don't know if it was Michael Phelps that said it, or if it's just a typical, like a swimming kind of cliche or whatever. It's the best swimmers are in the pool,
Yeah.
And one of the things I used to worry about, especially before I did some amateur MMA, was, is this going to really make me able to win a fight in the street? Am I going to be able to do that with this stuff? Which is why I started to compete. I started with karate and then I moved on to jiu-jitsu. And that was why I did it, was I want to make sure, I'm really learning something that's going to be, that may, if it has to, kind of save me on the street. And one of the things, the best swimmers are in the pool. One of the things I kind of figured out, and it was kind of this epiphany I had was, and people say it all the time, is got to remember 90% of people aren't doing jiu-jitsu. Mm-hmm. So if you do get into something on the street, chances are they don't know anything, and all you do is, that you're definitely, the odds are in your favor. But I didn't really take that to heart until, I heard this other saying, and I was like, you got to stop worrying about when you're on the mat, who submits you, who you can submit, and all this stuff. And especially now, Upiana will bring in these guys from Brazil like Pedro, Bruno Matias, another guy, great guy with this new guy, Enrique. And God, man, it's so humbling because he's bringing in these purple belts. And you're like, I have a black belt 5 years. And this purple belt comes in, and I'm like, Jesus, man, he just submitted me. And I know
it's a different thing these days.
Yeah.
And it's going to continue to be a different thing because each generation is starting younger and younger.
Absolutely.
I have 9-year-olds that are fucking good.
Yeah.
So what's that going to look like when he's 18?
Yeah.
You know what I mean? And like even Buchecha, like 13-time world champion, he told me, he's like, I started at 12. And he's like, man, I wish I started when I was younger.
Oh, I started at 26.
Yeah, I started at 22, And so it's like, there is...
No, 24. 24.
Okay.
24. I'm so old. You do math now.
But yeah, like, it doesn't matter what color of fabric is on your waist. It's hours on the mat in combination with your physical attributes.
Yeah.
So if you have a 25-year-old who's been doing jiu-jitsu since he was fucking 6,
yeah,
he has the hours on the mats, and then he has better physical attributes. So it's like, hey, it is what it is,
I remember the first IBJJF competition I did was 2000, and I thought I was on the Learjet to black belt. I had got my blue belt, I think, in 8 months. And there weren't a lot of legit black belts out there in schools. And the guys that were instructing me were, I think they were purple belts at the time. They had a lot of martial arts experience, so they kind of called it they call it Taikai Jiu-Jitsu. They're all black belts now, and, they have some big, big wins along the way. So it's a real high level. But, I'm a blue belt, got it in 8 months thinking I'm this bad jiu-jitsu guy, and I get to the Pan Ams, and they say, Andrew Doe, and I walk up there, and I'm like, yeah, and then they go, how's your Gracie, and I'm like, oh, shit, So I've got Hajar Gracie in the first round. I'm like, geez, man, I don't really know this guy, but his last name's Gracie. So
he was a blue belt the same time you were a blue belt?
2000.
Whoa.
Yep. And
dude,
it's crazy.
I want to hear how it went. Yeah. I already know how it went. It's Hajar Gracie. Yeah.
But that was kind of the first, that was the tournament. There were 60, I think there were 63 or 64. There was 63 or 65 people in our division. He submitted everybody. He just rolled through us. And I remember he came up to me after that. It was actually Hajar and Hoxton and myself, and we got a picture together. And I was like, why does he want a picture with me? He beat me in the first round. Who cares? Mm-hmm. And it was because when we were rolling, I was actually in Florida at Marcio Simas' school for the month. I was doing an elective for medical school. And I had trained with him, and he told me, he said, you should do the Pan Ams. I said, oh, no, that's a big tournament. He said, no, you should do it. You should do it. And at the time, I was doing a lot more leg locks, and he had told me, oh, yeah, you can do knee bars. And that was one of my favorite things to do. And I said, oh, I can do it. Well, okay. And Hajar had just gotten his blue belt. I think at that time, you had to be 18 to get a blue belt. Mm-hmm. Now it's 16. So he'd just gotten his blue belt, and they weren't doing any leg locks before you got your blue belt in Brazil, or with the Brazilians, because I think he was still him and his dad were in Birmingham, England, and he came up, and I kind of got into the turtle. He put his knee right between my legs. I rolled into a knee bar, and I had him. I'm like, oh, I'm gonna knee bar this Gracie,
How legendary would that have been?
And I feel this hand like on my butt, and I'm like, how the heck is he doing that? I'm like, he must be really flexible. But it was the ref. And he looked at me and he said, no knee bar. Blue belt, no knee bar. And I'm like, oh, no. So I'm on my head, thought I had a knee bar.
But wait a minute. So instead of him being like, oh, that's a violation of the rules, he was impressed by it, huh?
What, he just stopped? Yeah. Roger after it. Yeah.
For like, hey, this guy got me in a bad position. Let's take a picture. How cool is that, man?
Yeah, it kind of offset the getting smoked in the first round. But when I look back at it, I think it was one of his longest matches. I mean, I think it was only a 5-minute match, and we made it, and we were well past the 4-minute mark.
What did he catch you with? A cross collar choke from out?
Yep. Classic.
Dude, I must be psychic. Right?
Yeah. I don't know how you figure that out.
I tell my students all the time, because it's like, I'm your coach and I'm the one instructing, but you have to find your jiu-jitsu.
Yeah.
And I said, and don't let anybody tell you what the right path is. Because if you look at Keenan Cornelius or Gordon Ryan, they have an encyclopedia of jiu-jitsu that they can go to. And then the other side of the spectrum is Roger Gracie. He is going to mount you and cross collar choke you.
Yeah.
And it's like, what's the better option? You decide. You figure it out.
Exactly. Yeah.
You know?
And, I love the fact that Roger said, get really good at 10 moves.
Uh-huh.
And you think about it. I mean, this guy is still, I don't know anyone, to this day, he's the best jiu-jitsu guy in the world.
He is. And I hate to say that, because Buchecha is a personal friend of mine. And when I really believe their last fight was for the greatest of all time title.
Oh, yeah. Yeah.
Because Marcus surpassed him on IBJJF world titles. And then they fought to a draw the first time.
Yeah.
And I was there for that. But Marcus out-grappled him.
Yes, Marcus had the armbar. And I cannot believe Roger did not get injured on that.
Yeah.
I mean.
So it's like they both have this almost like legendary status in the sport. They had one tough fight that ended up being a draw. And now this is for everything.
Yeah. Yeah.
And Roger smoked him.
And I mean, and
bro, that doesn't, to this day, I've done 1,000 rounds with Buchecha, and every single time we slap and bump, I feel like a day one white belt.
Yeah.
I do not have jiu-jitsu against him, period. No. I can't pass. I can't sweep. I like nothing I have even begins to work. And then to watch another man do that to him, I'm just like, what?
Yeah, you realize, there's just that level. It's just, and that's jiu-jitsu. There's so many different levels and different games. And, I had one guy a few years ago that, like, I just couldn't beat him. And I would watch everyone I beat this guy. And it's just,
styles make fights.
Yeah. I just matched up so poorly with him, and, it'd be a stalemate. And I'm just like, this is boring. I can't progress. I can't figure anything out to get beyond it. But, the greatest thing is to watch Roger, and you can still say he's the greatest guy of all time. And everything he does, you can go, I can do that.
Yeah.
I can do that.
Yeah.
He's not baramboloing people. He's not, doing crazy submissions you've never seen before. You got to watch the video 1,000 times to figure out even how he set it up. No.
Yeah, like double buggy chokes and all this weird shit that's happening now. And again, you'll never hear me say what's right or what's wrong, but my personal journey is more in alignment with a Roger Gracie style.
Yeah.
Dude, I armbar people.
Yeah.
I'm a one-trick pony, dude. And, but I've honed it and I've honed it and I've honed it. And it's like, it's funny. Like that's the thing at my academy. Everyone's like, Coach will armbar you. Like it's
going to happen.
It's going to happen. But that's half of the fun of the journey is finding your jiu-jitsu. Yeah.
And I think that's why, as a martial art, jiu-jitsu just keeps snowballing. Is because people realize I don't need to be a great athlete. Mm-hmm. If you're a great athlete, you can be great at jiu-jitsu. But if you're not a great athlete, you can still be great at jiu-jitsu.
Yeah.
Because jiu-jitsu is so individual. Even with the belts, I tell people this. Actually, I went up to Idaho before they closed the academy. And there were a bunch of people there, so we did like a little mini seminar. And two of the things I told them, I said, listen, what I've learned, over years and years of jiu-jitsu is, if you do anything like if you go to a seminar and you're doing this stuff, I say, if you learn a couple moves, that's gravy. That's awesome. If you get a couple moves on a seminar that really work for you, that's awesome. I say, but what I realize now is what you need to concentrate on is how this person with a high level of jiu-jitsu looks at jiu-jitsu. Roger looks at it, basics. Someone else might look at it as, crazy. You got to roll and never stay on your left shoulder, just craziness. It can be anything because it's jiu-jitsu, it's infinite. And,
or like Danaher,
yeah,
examine the brains of the guys that seem to really have it figured out.
Yeah. And that's the thing you can really, really take from things like, we did, Braulio Estima did a seminar. And one of the things that has like totally improved my game just from that seminar is when I'm in somebody's guard, the position of my hips, just a little anterior tilt. And now my base is like infinitely better. And it's like, wow, this is crazy. How the hell did I not know this? I knew it for 20 years.
Bro, that's my favorite. Those epiphanies that are so powerful, but at the same time, it's almost embarrassing. Because it's like, again, 20 years of jiu-jitsu, and I didn't think of that.
And then, another thing to kind of go along with what you're saying is, your jiu-jitsu is your jiu-jitsu. When, like I said, when I got a black belt, that's my black belt. It doesn't mean I'm better than everybody else who's not a black belt. No, it means that for my level of training and understanding and knowledge base, I'm at this level now. And one of the things I think, one of the traps you can get set in is saying, okay, I'm a Haja Gracie guy. I'm going to do all the basics. And, we're doing techniques one night, and one of the techniques set up a berimbolo. And it wasn't until that point that I realized, the whole berimbolo and really why it works and how it works. And then all of a sudden I was like, gee, that's a lot easier than you think it is.
That's true.
And then I started to do it, and I'm like, yeah, this is always, when everyone says a flashy move, they say like a berimbolo. And then you realize it's not really that flashy. It's not really that difficult. It's just understanding it and positioning your body. And for me, it's always the very first movement that's the most crucial, because that's what sets up everything else. And once I learned that, I was like, oh, okay, I can actually do that. I still probably haven't done it more than 3 times in training, but
berimbolo for me was, I was a brown belt and I moved to Southern California. And I was at Lucas Leitch's Academy in La Habra. Mm-hmm. And as a brown belt, down there, all those guys knew inversion, berimbolo, all that stuff, because Southern California is like on the precipice of jiu-jitsu,
Yeah.
And I was partnered up with 2 blue belts, and they were just rip, like just drill it over and over and over. And I would get the grips, and just the angles and everything, it just didn't make sense.
Yeah.
But then I'm immediately like embarrassed.
Yeah.
Because it's like, dude, you're 2 ranks above these guys. They got it down, and it doesn't make sense to you.
Yeah.
But like you said, once you kind of crack the code, okay.
Yeah.
Yeah.
And there's basic things that occur over and over. And actually, there was a jiu-jitsu site that I started watching, and life and whatever, I kind of got pulled away from it, and I didn't save this guy's site, so I have to kind of figure out how the heck I got there, what rabbit hole I was in to get there. And he actually did a lot of physics of jiu-jitsu. Okay, here's the bump sweep. Well, you go up and you do it this way. Yeah, you'll bump him, but you got to use a lot of force, and that's because of the physics. It's easier to move him at a 90-degree angle or perpendicular than it is to try to move him parallel. And I'm like, oh shoot, yeah, that makes total sense. And just little things like, one of the cool things you'll love, because I know you love the armbar. Kenny Florian taught me 2002, 2004. I think I was training at Boston BJJ, and showed me this one little thing. Basically, sit up about 1 inch or 2 inches and mount. And then when that guy bumps, it takes away all of his momentum. And when I did that, I was like, oh my God, my mount is so much more stable. It's so much better now. I'm like, and that's it. That's the tiny little thing you need to do. And, over time, a lot of times I'll get with a lower belt and I'll get mount on them. And then they'll do all their bucking, do all this stuff. I'm like, man, I can't get you off me when you're mounted. I said, but I'm not really on you. And they're like, what do you mean? I said, my big game is pressure. And I'm like, I had pressure inside and pressure, all this stuff. And when I got to mount, did you feel as much pressure? No, I didn't. I said, well, that's because I'm doing this. Now I don't want to have that pressure, because then it defeats your...
Yeah, if you commit your pressure over their hips, now they can control you, actually.
Exactly. You move when they move.
Uh-huh.
And, I could see the light turn on for one of our blue belts when I was training with him a couple weeks ago. And he's like, oh, that makes so much sense. You know now. Now, I think as a black belt, you're aware enough to know when someone's going through what you went through.
Yeah.
Like, oh, yeah.
No, that's cool, man. One thing I always tell my students in relation to this is like, your belt color is nothing more than a representation of your journey.
Yeah, exactly.
That's it, man. That's
exactly.
it. Now, you do have to have some, like, if I'm going to put a purple belt on you, you're going to have legit jiu-jitsu.
Yeah.
And you're not going to get that until you do. But that is where your journey has to go before you get there. That doesn't mean, though, that, like, now that you're a purple belt, you can beat all the blue belts and the brown belts are going to beat you. It's like, I feel like, and you've been doing it longer than me, so let me know what you think. But I feel like when I first started, a purple belt's going to beat a blue belt.
Yeah.
You know what I mean? It's like there was this rank structure, and typically the winner and the loser would be in alignment with the rank structure.
Yeah, I think you're absolutely right.
And now, like you said, now you got purple belts, so it'll murk every black belt in the room.
Yeah.
You know?
And especially now when you get to a bigger city and a bigger area. And, I was actually surprised to hear, the Brazilians say that, the capital of jiu-jitsu is Southern Cal. It's actually moved. Brazilian jiu-jitsu has moved out of Brazil.
No, that's what they told me the same thing, because they're like, once your jiu-jitsu is good enough to make a living with jiu-jitsu and you're chasing the high level competition, Southern California is the place to be.
Yeah.
Yeah.
And, and I totally think you're right. You knew when you went into the academy, if a new blue belt shows up, unless he's like 100 pounds heavier than you, you're probably going to beat him. 9 times out of 10, you're going to beat him.
Yeah.
And I do feel like, and now it's so much more deceptive, especially being in a big city, because you got these young guys that are blue belts, but, they're not the blue belt you were.
That's what I'm saying. Like, and I don't even know who it is, but if you went and looked up the adult middleweight world champion blue belt last year, whoever you are out there, if you slap and bump with that guy, stand the fuck by.
Yeah.
You know what I mean?
Absolutely. Actually, I don't know who the middleweight would be. I think one of them would be Victor Sebro, who is the guy that trains with Draculino. I'm not sure if he was still a blue belt back then. But yeah, it's crazy, because I've rolled with Victor, and it's like, I'm a black belt and he's a blue belt, but it's not that old school. I've got the black belt and I'm going to beat everybody in the academy.
Yeah. Well, and it's important to say, like, and you kind of touched on it, how like you don't get your validity anymore by who you beat.
Yeah.
But if you're a higher ranked guy and there's people that are lower ranked than you that they have your number, don't hide from them.
Yeah. No.
You know what I mean? Don't, because you're missing an opportunity.
Yeah.
And just because they have a different color around their waist, if they got your number, you can fucking learn from that.
Absolutely. And one of the things I kind of did on my own, but one of the things that Upiano will stress is, put yourself in bad positions. Mm-hmm. Don't just do what you're good at all the time. Because that's not how you progress.
Yep.
And
then a caveat on that. If you put yourself in a bad position, I had this happen fucking 6 months ago. I let one of my white belts like pass my guard and work from side control, and I was getting strangled immediately. Yeah. And I didn't think that he had it in him to catch me. And I'm never going to be like, oh yeah, I was letting you work. Right? Because what you're doing is you're taking away that victory.
Yeah.
And Lappin articulated this best to me. He goes, I'll let my students work, but I'll never let you beat me.
Yeah.
So if you beat me, you have to know that you earned it.
Yeah.
And during lineup, instead of like, oh shit, coach got caught,
Yeah.
Instead of trying to hide from it, I was like, hey guys, for whoever didn't see over here, Evan, 17-year-old white belt, put me to sleep.
Yep.
Because that's jiu-jitsu.
Yeah.
And on any given day, like that can happen. And for me to pretend like it can't, I'm telling you guys a lie.
Yeah.
And so I was like, and I went out from a fucking 17-year-old white belt. I was like, man.
But you'd rather go out in the academy. You'd rather go out in training.
100%.
You don't want to go out in a street fight. You don't want to go out in a tournament.
Yeah. And bro, it was one of those chokes. It was bizarre to me because he had it locked in, and I was still 100% sure that when I'm ready to escape, I can escape.
Yeah.
And then I went to escape, and then I was out. Like, I didn't have time to tap because I didn't think that it would be real.
Yeah.
And it was like, and I'm not one of those guys that goes out in training. I tap out.
Yeah.
when you got, and I'm not, the mistake for you to be on my neck strangling me, I already made the mistake.
Yeah.
So I have nothing to gain by just going unconscious.
And hoping you give up.
Dude, let me ask you this as a doctor, and this is just a theory, but if you look at fighters like Chuck Liddell,
yeah,
his chin was granite.
Yeah.
When he was younger. Rampage Jackson could fucking tee off on him, and he'd eat him.
Yeah.
And by the end of his career, Rich Franklin was jabbing him, and he would drop like a sack of potatoes.
Yep.
So your body becomes more accustomed to going unconscious once it's been exposed to it. And I think a lot of people attribute that to trauma from striking, but I've seen it with jiu-jitsu.
Oh, yeah.
I have guys that that will refuse to tap and go out, and then it gets to the point where you touch their neck and they're out.
Yeah.
So do you think that's like a physiological change, or almost like a self-defense mechanism that the brain is like, okay, he's going to wait until we go out again, so let's just go out?
Yeah, it may be, it may be this kind of, because, the brain can desensitize things, like when you hurt your back and your sciatica is horrible. Over time, it gets a little better because your body says, wait a minute, we're not dead, even though we're in this much pain, so we can stop focusing on this pain. So it downregulates that pain sensation. And there's no reason it can't upregulate it, and make you more sensitive to things. And the big thing with, this whole, especially in the NFL with CTE, all these head injury things, fighters and Muhammad Ali and all that stuff is, the mechanism is traumatic, but the insult is still, because you've had this trauma to your brain, you get the scar tissue in your brain, you're not getting the proper oxygen to the cells, and that's what it impairs. And, it chokes no different than that. And then you also have these little nerve receptors on your carotids, and, so they definitely can be regulated. And I wouldn't be surprised because, you see these guys, how many guys get their first concussion in the NFL and then have trouble with concussions? Pretty rare. Most of the people, like Brian Cushing, trains at our gym, and he was telling me the other day that he got his first concussion in baseball when he was a kid. So I think the younger you are, the more susceptible you are to kind of getting this heightened response. Like you said, all of a sudden you touch their neck and they're out.
Yeah.
So, and then for us older guys, hopefully we're healthy enough and fit enough, but still, genetics are genetics, age is age. You got to start worrying about, the blood vessels in your neck. Yeah, you got to worry about your joints too, because we're old as fuck. But, the blood vessels in your neck can get narrowed and they get twisted and they get, they get a little stiffer because we're older. So, you got to be a little bit, I lost my ego a long time ago. And actually it was when we started to train with, I was in Syracuse, New York with Tai Kai and Kenny Cronenberg, those guys up there. And we became a Machado school. And their slogan is, leave your ego at the door. And, I really thought, hey, that's probably a pretty good way to live by, I don't need to break my arm to prove that I'm tough and I won't tap. I'm not going to get to where I am today with jiu-jitsu. I'm getting there with my mind and, my hands. But, I
always say there's a dichotomy to that though. Cause like, if you want to be a winner, if you're trying to win in a combat art against another man, that's an ego-driven activity.
Oh, definitely.
But you have to find the balance.
Yeah.
Yep. And I think the balance is like fight hard and try and win and bring like a good, healthy, competitive spirit. But then when you face defeat, that's where you have to accept and not bring ego into it.
Yeah, live to fight another day.
Yeah,
right?
because you get people that are like losing in the gym, like causes like emotional turmoil in them.
Yeah.
And it's like, dude, that's not what this is about.
Yeah.
You know?
Yeah.
Well, dude, a couple other things I wanted to ask you about before we wrap this up. Do you have an opinion on peptides?
So
like 157, TB 500, that kind of stuff.
Yeah. So I do. I think they're very promising from the evidence we have out here. And actually, when we went up to Seth's for the first Steel Foundation thing, and Guy went with us, Guy Metzger, I still contact him from time to time, text back and forth, and ask him about different peptides and things like that. That's what he's doing his PhD on.
Okay.
So he's a great source for that. And
that's an interesting motherfucker, man.
yeah, that's like a crazy.
He'll go down some rabbit holes with you, but it's kind of fascinating. You know?
Absolutely. Absolutely. And, you know, they definitely are showing promise. I think, you know, starting, you know, sequencing the human DNA and starting to see things. And actually, my wife was a physician we were talking about the other day. You know, they said, well, we're not going to sequence all of the human DNA till at least 2025. And then we did it by like 2005. And then because the power of computing just got so much better, so much faster. And we used to say, I remember when I was in training, we'd say, you know, there's no DNA of race. You know, you can't tell what race somebody is by their DNA, but now we know we can. You know, all these different things we can figure out with our DNA. And we're just kind of in this infancy of figuring out, you know, how these things get manipulated and all this stuff, and like the peptides and all that thing, how they actually work in with all this different stuff in our body. So I think, you know, there's peptides are very promising. These exosomes and growth factors are super promising. You know, and we even see it in, you know, if you want to call it established medicine, you know, the kind of the mainstream standard of care medicine. We even see it, especially with what I do. The main part of my practice is doing these newer procedures that keep people from having these huge surgeries that people used to have. You know, you used to have a blockage in the artery in your leg, and they used to cut you open and sew one side of a Gore-Tex graft and then drag it under the skin and sew it to the other part beyond the blockage. And, you know, you hoped it stayed open. Nowadays we go in start with a little 21 gauge needle, and we can, you know, go in there and get tools that'll cut the plaque out and, you know, leave your own artery in place, get rid of the gunk that's in it and open it back up. And, you know, it's kind of like we can do that so many more times than we can do this bypass thing. And, you know, it's really, you know, we're kind of progressing with the technology in medicine.
Yeah, you were telling me yesterday about like the progression of how you're treating prostates.
Yeah.
It's fascinating.
Yeah. And
because you do, I mean, I don't know all of what you do, but what would you say is kind of like the bread and butter of this office? Like,
so my specialty is called vascular interventional radiology, and basically I do surgery using radiology, and the vast majority of what I do is fixing some kind of vascular problem or some kind of problem utilizing the blood vessels.
okay.
Whether it be shutting off bad diseased veins, whether it be opening up diseased arteries, or whether it be cutting off the blood supply to a prostate or to a uterus to cause it to, you know, shrink down and get rid of your enlarged prostate or uterus symptoms, you know. So it's kind of using x-rays to do surgery to manipulate blood flow.
Got it. It's fascinating.
In a nutshell, plumbing on people.
Yeah. And then we have a lot of people that listen to the show that are also veterans.
Yes.
And are either in the military or considering a military career.
Yes.
Even though the current administration is stifling that dramatically. But did you become a physician through the military?
So, speaking of administrations, I was finishing up, let me see, I'm trying to remember. God, I'm old. Oh, I was finishing up college, and I was looking at going in, it's HPSP, Health Professional Scholarship Program. So basically I would have gone to medical school, 100% paid for by the military. And then when I came out, I would owe them the 4 years of med school. I'd owe them 4 years of active duty.
Okay.
So
that's a pretty good deal.
Oh, it's a great deal. The only bad thing was they had a little bit of control on what specialty you'd go into, but not too bad. And I applied for that, and it was Clinton cutbacks. And they said, wait, you had a back injury when you played football. We want to work it up and all this stuff. They worked up totally negative. I was fine. And they said, well, we don't want to take the risk. So they didn't want me at that point. So then my intern year, September, was when September 11th happened. And I said, I bet you they'll want me now. So,
Yeah.
So I'd actually already finished my training, and I was in my, internship, apprenticeship. And
so you went through just, I guess you call it civilian medical school. Did you?
Yes.
And then
civilian medical school.
Up to your eyeballs in student loans.
Yeah. Yeah. And the nice thing was I did what's called the STRAT program. So it was a reserve program. So instead of owing 4 years of medical school, I owed 8 years, or 4 years of active duty for medical school. I owed 8 years of reserve duty.
And in return, they pay off all the student loans.
They didn't pay off all my loans. They gave me
what the fuck, dude?
Well, I was smart. I went to a state school, so they gave me $50,000 towards my loans, which was a huge help. It didn't pay them all off.
Dude, medical school these days, $50,000 wouldn't even make a dent in it.
Yeah, well, if you go to a state school, it can.
Oh, okay.
But so it really helped. It didn't pay everything, but they gave me a full reserve soldier's salary. So I basically made almost double what my fellow residents were making because the Army was giving me I was a full-time reserve soldier.
Did you ever switch to full-time active duty, or did you do your career as a reservist?
I did pretty much everything other than my deployments. I was reserve.
Okay.
Yeah. So, and one of the big things I do with my practice is, not only is it a veteran-owned business, but, we always try to take care of our veterans. Between Tage, my friend Tage, our friend Tage, Navy SEAL, we're working with the Navy SEAL Foundation, and we've got it set up where they just give me, they just pay me to do the injection, and I just do the Medicare rate, and then they actually pay for the whatever regenerative therapy that we're going to use, and they'll pay for that, and then they'll just pay me to do the injection and the whether it be a SEAL, the operator, or I don't exactly know everybody that's the SEAL Foundation if they just cover SEALs, but they cover everything.
Yeah,
and
that's
the
cool.
SEAL doesn't have to put anything out of their pocket.
Because, dude, I don't know a guy who's come out of special operations.
Yeah,
who doesn't need some type of treatment from you. That person doesn't exist.
No.
I
don't know. I don't know many guys that even your basic 11 Bravo.
The military fucking breaks
some first
you
sergeant
down,
decides, hey, let's do a 10-mile ruck hike in some shithole we've never been to and have no idea what the terrain's like, and guys twisting ankles and hurting knees and things like that. So yeah.
Not to mention the airborne units. Were you airborne?
No.
Okay.
No.
Lucky you. Yeah. I always tell people, how you know if someone is legitimately part of an airborne unit or not? You ask them how they like jumping. And if they're like, oh, dude, jumping's awesome, it's like, you're full of shit, dude. Yeah. Everybody I know hated it.
Yeah.
There's nothing enjoyable about throwing yourself out of an aircraft in the pitch black at fucking 1,000 feet with 85 pounds of gear on you.
Yeah.
Like
in an environment you're maybe remotely familiar with.
Yeah, dude.
And I actually, a friend of mine met one of the most interesting guys I've ever met in the Army. He was 82nd Airborne and active duty, left, and then signed up in reserve, and his reserve unit was an airborne unit, but he had gone back to law school. So when he deployed, he was actually a JAG officer, which was kind of what I did. When I deploy, I'm a radiologist, but when I'm stateside, I actually was a commander of a weapons instructor unit. More for me because I don't like that feeling of not knowing what's going on.
Yeah.
So I want to know how the Army worked, and that was actually a sad. Some things I wish I didn't know.
Yeah.
I got to the end of my first fiscal year, and they said, Major Doe, you got $550,000 left over, and I'm like, yeah, good job, right? No. Spend your money. You won't get it next year.
Bro,
I'm like,
yeah.
That's stupid.
Dude, the government and their fiscal years and their budgets, it makes you understand why we're fucking trillions of dollars in debt, dude.
And here's the kicker. Like, I had to spend it.
Yeah, that's what I'm saying. Like,
and I'm a weapons instructor unit. So I'm like, okay, well, let's just buy all new, M4s, all new 9mm. Let's buy a shit ton of ammo. No, you can't do that. What? Well, you can't procure ammo unless you have a range. I'm like, oh, Jesus. I'm like, what the hell am I going to do?
Bro, I'll tell you what, coming from special operations, and then I told you, like, I went and did a stint in the reserves afterwards. Yeah. And because I came out of regiment, immediately they wanted me to be like one of the cadre on the range, right? Because I was certified as a range cadre. And we're preparing to train the company on the M249, familiarization with the saw. And they're like, hey, each, dude, this is fucking blow your mind. Each member of the company is going to get...
Probably not.
Each member of the company is going to get 4 rounds. And I said, 400 rounds? And the guy's like, no. We only have 2 drums of saw ammo for today's training for the company. So it'll give everybody a burst so they can feel how the weapon cycles. And I said, are you guys fucking serious? We're taking the whole company to the range so everybody can get 1 burst. And I said, hold on a minute, okay? I'll be right back. And I got in my Mustang. And I learned after the fact, you weren't supposed to do this because I don't know how the big army works. Yeah. I drove down the street to regiment and walked into the headquarters and talked to the staff duty officer. I said, hey, bro, I just left the regiment fucking, 8 months ago or whatever it was. And I said, here's the deal. I got a fucking company of people that need to train. The regiment has unlimited ammo. Yeah. I said, how much fucking M249 ammo can you fucking give me? And he goes, dude, follow me out to the fucking the ammo shed. And he gave me 4,000 rounds. Yeah. And just threw 4 crates of ammo in the trunk of my Mustang. And I drove back down the street to my reserve unit. And I was like, okay, guys, now we can get some actual training.
And at some point, their OIC had to account for those rounds. Where the fuck did they go?
So, but here's the funny thing. You know what they said to me as soon as I got back to the reserve unit? They're like, Anderson, dude, you can't transport ammo in a POV. And I'm like, that's where their mind goes. Not, hey, cool. You came up with a solution and now we're going to have a day of training. And I didn't get like reprimanded or in trouble. Yeah. But it was like, dude, what the fuck are you doing? You can't, just so you know, you can't do that. And it's like, yeah, you can, because I just did.
I just did it.
Bro, that's not the Army.
Yeah. You know? The funniest thing I've ever seen with this kind of, you can't do that, was we had a JAG officer who had gotten tagged to go to Afghanistan to be the attaché for the 2-star. And he was Coast Guard. And I said, fuck, did you get, pulled to go to Afghanistan? And he's like, well, my friend's in the Army. We went to law school together, blah, blah, blah. The general asked him if he was demob, and he said, do you have anybody that you'd recommend to fill this spot? He said, well, the only guy I really know I think that would do a good job is my buddy, but he's Coast Guard. And the general said, don't worry, I can take care of that.
Cut him orders, huh?
So long story short, we get our tabs, we get our uniform. He gets his uniforms, he gets his tabs and everything. And he goes to the print shop and he says, hey, can you print me up some of these tabs that say Coast Guard on them? And the kid goes, no, we can't do that. And he said, well, you can print anybody's last name, right? And he said, yeah. He said, well, pretend my last name is Coast Guard.
And just give me 2 fucking tabs.
Yeah. He wouldn't do it. He got his NCO to come up front. And he's like, oh, sir, we can't do that. We can't print anything other than U.S. Army.
Man, it's such a fucking...
We went to Ranger
inability. Yeah, the inability to think outside of the box sometimes is fucking blow your mind.
Oh, man. So for my unit, I bought a turret. I bought a turret for a Humvee. I didn't have a Humvee. I didn't even have a 50 cal, but I had a turret.
I don't get it.
And then I sent it back because I spent all my money. So I could spend all my money.
Oh, that's what you ended up getting, huh?
Yeah.
Jesus.
And, all the stuff I could have used, I could have really spent the money on for the unit. I wasn't allowed to buy for whatever.
Well, and bro, part of that fiscal year and that budget, like we used to have what we called spendex. Yeah. Because it's the same thing with your ammo. And it's like, hey, this ammo was allocated for this fiscal year of training. And if it's still there, we're not going to get as much next year. And I literally remember they're like, hey, Sergeant Anderson, take your team out and do a spendex on this fucking pallet of fragmentation grenades. And bro, we threw frags for 3 hours.
Yeah, and you think
zero training value.
You think to yourself, I never thought I'd get sick of this, but I'm sick of this.
I'm real sick of this. And it's like, dude, we've done spandexes with like smoke grenades and shit, and it's just get rid of this. And it's like that. There has to be a better option.
Yeah.
Like there is. And the fact that fucking no military leadership has figured out what that better option is, that it's just, this is how we've always done it. So this is, it's fucking insane.
Somewhere along the line, there's a reason that they don't want to figure, they figured out a long time ago. They just don't want to do it. I remember with our unit, I started with this unit and I got to learn so much about how the Army really works. And then I started to learn about kind of the stupidity of the Army way or the DOD way. And then by the end of it, I was like, my God, we are just like political pawns. This is a joke. And one of the things was we're at the range, and you used to go to range, shoot everything, go home. You go to the range, you'd shoot all your ammo, and they'd say, oh yeah, remember, police your brass, police your brass, police your brass. And then the second year I was the commander, they were like, no, don't worry about policing your brass. And I'm like, well, why not? And then, all of a sudden you realize, cash for clunkers and all this stuff. And you're like, in reality, we were just getting raw materials, brass, to send to China so they could use them for manufacturing. And, and I'm like, man, this is crazy. This is,
yeah.
Are we soldiers, or are we just, wasting time and, generating something so we can make somebody else happy? And
bro, I don't know. I mean, how far down the rabbit hole do we want to go? It's like when I was a young man, I enjoyed deploying. I enjoyed combat because it's like, this is what I do. But now when I reflect on it, it's like, dude, what the fuck? Why did I spend 5 years in Iraq?
Yeah.
Like, what was the end game there? And now when you see like they're mobilizing everyone for Ukraine, and I think of all those 22-year-old guys that are going to fucking go over there, and it's just like, why are we always doing this without like a strategic plan and an end game and an actual mission focused goal? This is why we're going to do this. Once this is obtained, we're fucking out. No, we just throw ourselves into these fucking endless wars. And bro, the best warriors, the strongest warriors I know, everybody's sick of it, man.
Oh, absolutely. And one of the frustrations for us was, especially for the reserve physicians, so we're guys doing our doctor stuff, taking call, working hours, doing all this crazy shit. And then we're willing to pick up and leave our family, leave everything behind, go to some godforsaken place just to take care of a bunch of people we don't even know because we're in the same, fraternity, sorority, whatever you want to call it. And I remember being in Iraq, and the battalion commander, the cool thing is the battalion commander for who we were under, he's a physician as well. Mm-hmm. So, and within the medical corps, we have rank and file and everything, but it doesn't hold as much weight.
Yeah.
Because we know, we know what each other's capable of. And, we went there, myself and my battle buddy, who was a cardiac surgeon, were like, listen, get us out of here. We're sitting around twiddling our thumbs. There's nothing happening in Al-Asad Air Base, Iraq. I think he had taken out an appendix once in the 3 months we were there. That was his sum total. And he said, well, what do you want to do? I said, we don't care. Send us to Afghanistan. We signed up to help soldiers. Let us help soldiers. There's got to be somewhere you need us. And they're like, no, we're just checking a box. We're filling a slot, and that's what you're here for. And it's frustrating,
Yeah.
You're like, if I'm going to leave everything behind, I want to know I'm doing some good.
Especially as a reserve capacity, because you got real life going on back home.
Yeah, absolutely.
And,
if I were to leave today with my practice now, my practice shut down because...
Yeah, you're fucked.
Yeah, exactly.
Well, dude, I think a way that I always like to wrap up the show is as you've put out a ton of fascinating information, but you also offer a service that I think a lot of people are going to be interested in. So what's the best way to find you, contact you, websites, read about what you do and all that stuff?
So, always go to our website, Alate Health, ALATE health.com. Find out about all the stuff that we do. Obviously I have Instagram, at Andrew L. Doe _MD. And then, we also have an Alate Health Instagram as well.
Okay.
And I'm really good about returning messages and, DMs and things like that.
So text me those 3 links.
Absolutely.
And what I'll do is I'll put them in the show notes below. Because like I said, everybody listens to this show on Apple or Spotify.
Yeah.
And you can just swipe up and have all the direct links in the show. So if people are listening, they can just swipe up and look there and then get in direct contact with you.
Cool.
Well,
all
cool,
right.
Cool, man. I appreciate your time. I think this was a fucking fun episode. Army stuff, jiu-jitsu stuff. And
I tried to stay out of rabbit holes, but
no, it's good. Anything else before we wrap this up that you need to share? You think we covered it?
No, I think we're pretty good.
Okay, man. Well, cool. Right. I appreciate it.
All right. Thank you.